Well, there are guidelines that we follow in medical oncology in terms of identifying individuals who should be screened, and there are definite individuals who, based on their personal history, based on their family history, based on a constellation of their other medical history, and also sometimes their heritage, raise our suspicion that they should be tested for certain familial predispositions to cancer, not just breast cancer and ovarian cancer, but there's other cancers that fall into those categories. And while I think we do an okay job in terms of identifying some of those individuals, it's likely we're probably missing some individuals because we just don't know the full spectrum of what's entailed in having these familial syndromes. So to pick out those individuals or those families where maybe they don't present as textbook, and so we're not thinking to test those families. And one of the things that's happening now, as we're doing genomic testing, which is testing on tumor tissue itself, we're actually finding surprises in that we are finding alterations in genes that we had not previously identified as this person may be having a familial predisposition. Those kinds of tests that we do in terms of the genomic profiling don't tell us for sure. They're not designed to tell us that this patient has a genetic predisposition to a familial cancer, but it gives us a hint. And so now we're able to go back and say we need to do the appropriate testing to determine whether or not this is a hereditary cancer. And the reason that's important is because it can influence the treatment, the screening, other health maintenance for the patient in front of you, but also some of their family members. So we are likely, at this point, missing some individuals who should be screened, but by the same token, we may be over-screening other individuals because there is a heightened awareness in terms of the role of genetics and familial predispositions in cancer susceptibility. The only caveat or challenge there is that I think because of that heightened awareness, individuals think that their risk of having a familial predisposition is actually very high, when in fact we're generally talking only about 5 to 10% of all cancers that present to us.